Sam Vaknin's perspective on borderline personality disorder. Sam Vaknin portrays BPD as a condition of extreme internal chaos, a labile, rapidly shifting sense of self and emotion. He writes that borderline patients have an unstable self-image with chronic feelings of emptiness. In his view, BPD is defined by intense emotional dysregulation, identity disturbance, and a complex interplay of self-states. People with BPD oscillate between idealizing and devaluing others, especially loved ones, driven by deep fears of abandonment and engulfment. Their emotions often feel dissociated or split, resulting in impulsive, self-destructive behaviors as they struggle to maintain a coherent identity. Ultimately, Vaknin argues, those with BPD have a profound need for connection and validation that coexists with an overwhelming fear of intimacy and rejection, emotional dysregulation, and identity instability. Vaknin emphasizes that BPD is first and foremost about extreme mood swings and identity fragmentation. He notes that borderline's emotions are all over the map, swinging dizzyingly between dysphoria and euphoria. This resembles bipolar disorder, but he argues borderlines are much angrier and more prone to rage attacks and violence. In fact, he observes that under stress, many become briefly psychotic, experiencing paranoid thoughts or ideas of reference. Reflecting this instability, Vaknin cites a description of identity in BPD as a markedly impoverished, poorly developed, or unstable self-image, often associated with excessive self-criticism and chronic feelings of emptiness. In other words, the sufferer's sense of who she is can shift abruptly, leaving a gnawing emptiness at her core. In Vaknin's words, BPD literally straddles the thin borderline separating neurosis from psychosis, highlighting how close their inner world can feel to breaking apart. Abandonment, anxiety, and relationship patterns. A central theme in Vaknin's analysis is abandonment anxiety. He calls it the main dynamic in borderline personality disorder. Borderlines, he says, attempt to preempt or prevent abandonment by clinging desperately to loved ones. This leads to a characteristic idealized devalue cycle in relationships. At first, the borderline sees a partner as a savior, then suddenly flips and treats them as an enemy. As Vaknin puts it, a fierce attachment is coupled with idealization and then swift and merciless devaluation of the other person. He also notes that borderlines harbor a second anxiety, engulfment fear, which makes them oscillate between approaching, idealizing, and avoiding their partner. In practice, this means borderlines can go from clinging lovingly to lashing out with suspicion almost overnight. To manage their unstable self-esteem, borderlines constantly seek external validation. Vaknin explains that a BPD person craves attention, affirmation, adulation, and approval to regulate her gyrating sense of self-worth and chaotic self-image. In his words, she needs this perpetual narcissistic supply to shore up serious deficits in self-esteem and to counter the emptiness she feels. Thus, his view is that the borderline's love-hate roller coaster serves a desperate internal need to keep the self intact by any means. Impulsivity, recklessness, and self-destruction. Vaknin stresses that borderlines are highly impulsive and risk-prone. They are impulsive and reckless, he notes, similar to narcissists and even psychopaths. He describes behaviors such as binge eating, gambling, careless driving, compulsive shopping, and substance abuse as common among BPD individuals. This lack of impulse control often manifests in dangerous, self-defeating acts. For example, Vaknin points out that borderlines frequently engage in self-destructive and self-defeating behaviors, including suicidal ideation, suicide attempts, gestures or threats, and self-mutilation. In short, their impulsivity can swing toward both thrill-seeking and self-harm. These extreme behaviors reflect the internal turmoil Vaknin sees as core to BPD. Without a steady self or healthy coping, actions become frantic and destructive. Mood instability, rage, and brief psychosis. In Vaknin's account, BPD mood swings are more severe than those in common mood disorders. He emphasizes rapid cycling of mood, from sadness or depression to euphoria or manic self-confidence, and even paralyzing anxiety or indifference. Crucially, he observes, anger dominates. Borderlines usually get into physical fights, throw temper tantrums, and have frightening rage attacks. Thus, unlike a typical bipolar pattern, Vaknin insists that borderlines are much more violent and irritable than they are simply manic or depressive. Vaknin also highlights that under extreme stress, many borderlines experience brief, psychotic episodes. They may lose contact with reality